Hello, and welcome to the Dr. Medic Anesthesiology Explainer series. Let me ask you a question. What if the most common anesthetic agent in your OR, the one you use every day, had an evolution? One designed specifically for greater hemodynamic stability in your most vulnerable patients. As a quick reminder, this content is for educational purposes only and is not intended as medical advice. The information we're covering today is taken from the following peer-reviewed source. So here's our roadmap for this briefing. We'll start with what we're calling the Propofol paradox. Then we'll introduce Ciprofol, dig into its pharmacology, and compare its performance in the clinic. We'll specifically look at advantages in high-risk patients and then discuss future directions. For all of us in this field, Propofol is fundamental. It's our go-to. The rapid onset, the smooth recovery, it's really unmatched. But, as we all know too well, its widespread use comes with a set of well-documented clinical challenges we have to navigate in every single case. We're talking about three main issues. First, there's the injection site pain. But more critically for us, there's the dose-dependent hypotension and respiratory depression. These aren't just side effects. They are serious hemodynamic and respiratory events that demand our constant vigilance, especially when our patient has very little physiological reserve. So, in direct response to these limitations, a new agent has been engineered. It's called Ciprofol, also known as HSK 3486, and it was designed from the ground up with a very clear goal: improve upon Propofol's safety profile. And that's the crucial point here. The objective wasn't to reinvent the wheel, it was to refine it. The goal was to keep the anesthetic efficacy that we all rely on with Propofol, but at the same time, significantly enhance patient safety. So how does it actually achieve this enhanced safety? To understand that, we have to look at the pharmacology, right down at the molecular level. Both agents, at their core, work the same way. They modulate GABA-A receptors, which enhances inhibitory neurotransmission. But here is the critical difference. Ciprofol has a unique structural modification, the addition of a cyclopropyl group. This small change is what increases its binding affinity for the receptor, and that is the molecular basis for its improved safety and reduced side effects. You are watching the Dr. Mech Explainer series. Okay, so the pharmacology makes sense, but what does this mean in the clinic? How does Ciprofol actually perform when you put it head-to-head against Propofol?
Well, the clinical trials give us a very clear picture. With Ciprofol, there's a reduced incidence of injection site pain. But, much more importantly, the data demonstrates a lower incidence of dose-dependent hypotension, a lower incidence of bradycardia, and a lower incidence of respiratory depression.
And this really brings us to what might be the most significant clinical advantage. The incidence of hypotension, a primary concern in so many of our cases, is demonstrably lower with Ciprofol. This improved hemodynamic stability is really the key differentiator in practice.
So, how does this all translate into the OR? Well, it has profound implications, particularly when we're caring for our most vulnerable patient populations. Studies specifically looked at high-risk groups. Ciprofol has shown consistent efficacy and safety in elderly patients, in patients with significant hepatic or renal impairment, and in the critically ill. And importantly, it often does so without needing the kind of dose adjustments we would typically anticipate. The source literature actually sums this up perfectly. It says Ciprofol demonstrated consistent efficacy in elderly patients and those with hepatic or renal impairments, with minimal need for dose adjustments. That level of predictability is a substantial clinical benefit. Okay, so what's the overall takeaway from the data we have so far, and what does the path forward look like for this new agent?
The evidence strongly suggests that Ciprofol is a significant step forward for intravenous anesthesia. Its profile translates directly to enhanced patient safety and comfort, which positions it as a very viable and perhaps superior alternative to Propofol, especially in our high-risk cases.
You are watching the Dr. Make Explainer series. To stay current with the latest clinical updates like this one, please subscribe and make sure you select the bell icon. Of course, the story isn't over. Future research has to focus on some key areas. We need to evaluate its long-term safety, we need to assess its role for sedation in the ICU, and there's also a need to explore potential neuroprotective effects, which could open up entirely new applications. And this leaves us with a final thought for your own practice. As this agent becomes more available, which of your upcoming cases, maybe that frail elderly patient or the patient with severe comorbidities, might make you pause and consider this new anesthetic?